Hello and welcome to This is 65. My name is Erin Ackenheil. I own Black Point Insurance, where we help Medicare beneficiaries nationwide learn about the A, B, C's, and D's of Medicare. And through that process, we meet amazing individuals, advocates, people in their encore career, authors, people who are just doing great things in their community and have something to say because they care and have passion for their lives and the work that they're doing, and always an inspiration. And through that process, I get to bring them onto the show. And today I'm very excited to introduce one of my clients. We have on board today William Luhr. He's on the show today. And we've been working together on Medicare plan coverages for a few years now. And William and I were kind of noting that he's had to navigate a few different plans, different authorization processes, different network of doctors. And he's finally landed on one that seems to be working well for him. But he really has done a breadth and depth of research and work within the plans to create a good experience, maximizing the most in terms of bonus benefits, navigating authorizations, working with agents like me to identify the right choices. And he's got a story to share, and he thinks he can provide some great advice and tips. And I agree on everything healthcare. So I'm going to welcome from backstage, welcome William Luhr. Thanks for joining the show today. How are you?
I'm good. Thanks, Erin. Thanks for inviting me on your show.
We'd love to have you. So, tell me a little bit about your background. What's your story? Where are you from? Your work life? Tell me everything.
Okay. Well, I was born and grew up in a sort of upper middle class suburb of Chicago, which was kind of lily white and flat and boring. And so when I turned 20, I moved to California because I loved it here. And I started working and going to university part-time, and eventually received my bachelor's degree from San Diego State University. And then I went on there to get my master's in social work degree there.
Amazing.
And what I really wanted to do when I was in my starting my career was to become a psychotherapist. I was very interested in what makes people tick and human behavior. And so I started out my career. I got excellent training in outpatient psychotherapy at UC San Diego. But I couldn't find a really great job in that field. And it was like the mid 80s. And it's just when the AIDS crisis was hitting in San Diego. And as a gay man, I figured I needed to, learn something about this epidemic that was happening and to get involved in help. So I started doing some volunteer work and met amazing people who were stepping up and trying to do something about this epidemic. It was a very tumultuous time, but a very inspiring time. Especially some of the women that I met who stepped up and did volunteer work and helped in the AIDS crisis. Just amazing people that I'll never forget. In a time like that brings out the best and the worst in people, just like we saw with the COVID pandemic. It brought out the best and the worst in people. And so I shifted from a career in psychotherapy to a career in medical social work. And during those years, I spent about 5 or 6 years working with hemophiliacs who had been affected by HIV and AIDS, and it devastated that community. And it was a very interesting and challenging community to work with. And I really was honored to be part of that.
How did that work, William? So first of all, was that in San Diego or up here in Northern California?
In San Diego, yeah.
And I was curious how that works. So did you work for, like a social work office? Were you working within the hospital? How did you get referrals of people? And it sounds like you made a huge impact. How did you get infiltrated, I guess, into that exact specific line of work?
Yeah, well, it's a complicated disease, and there's nationally recognized hemophilia treatment centers in various parts of California. There was one at UC San Diego and San Diego Children's Hospital. So I was working for a statewide organization with state funding to try to address the needs of this community who are being hugely impacted by the HIV epidemic, and worked closely with physicians and nurses and social workers at those hemophilia treatment centers to provide mental health services to those, men.
Such a huge need.
boys.
Amazing. Such good work. And before we really had the resources, you were at the ground level, which is incredible. So how did you land up in San Francisco? Did your work take you here, or how did you end up in the Bay Area?
I first moved to San Francisco when I was 20, and then I ended up in San Diego, but I always wanted to come back to the Bay Area. It's, I always considered it my home. I wanted to live in a city, and San Diego was too suburban for me. And so at that point, the next logical step for me after working in the HIV world, because so many people were dying, this was in the early days before there were effective treatments. I watched so many people die, and strangely, it didn't affect my personal life. I didn't really know people in my personal life, strangely and fortunately, who were affected by AIDS, but my professional life was nothing but watching people die. So the next logical step for me was a friend suggested I come to work in hospice, which was the next logical step because of my skills and experience in dealing with end-of-life issues. And that's where I spent the next 30 years of my career, was working in hospice. And,
amazing. Anybody who works in hospice, period, is like an angel on earth. That's unbelievable. So how was that experience for you?
I was so blessed. I had a marvelous career. I met the most amazing people, not only the people that I worked with, the nurses and physicians and chaplains and home health aides that I work with, providing end-of-life care to people in their homes, but I met the most amazing people struggling to come to the end of their lives. And I always say that I learned something from each and every one of them. Some of them taught me how to do it well, and some of them taught me how not to do it. I learned so much about how to face our mortality, and was able to witness people going through that process, people from every walk of life. So many people who work in my field in social work are dealing with, at-risk groups and underprivileged groups and people with mental health disorders and disabilities. And I got to work with everybody, the whole cross-section of humanity, every race and every, from the very rich to the very poor, and to be in the field visiting them in their homes. And it was such a privilege. I met the most amazing people. I learned so much. It was a very powerful experience. And eventually I ended up in management, managing a team of people in the field. But it really was a marvelous career. I was so fortunate.
Yeah, thank you so much for your work. That's incredible. So, 30 years of that, and it sounds like you finally retired. So what have you been up to since then?
Yeah. Well, there was a lot I wanted to do. I retired a little bit early. I was 63. Since I didn't have kids, I figured I didn't have to send kids to college. I can retire a little bit early.
Definitely an advocate for no kids, because it's expensive.
Although it also means I don't have any kids to take care of me in my old age. So, but it's never a guarantee anyway.
Yeah, true.
So I've been, there's so many things I wanted to do in my retirement, and I've been staying busy. And as everybody or many people say, I don't know how I ever had time to work, because every day is just filled. And I have a wonderful home life. I love my home and my garden, and I spend a lot of time here. I have I'm a dog lover. I don't have my own dog right now, but I'm doing some dog sitting. There's one here behind me on the sofa. That's
I can't see
Dash
him
back
right
there.
now.
He's a
He'll
multi-queen,
Dash
and
make an appearance, I'm
you
sure.
know, and I miss my beloved French bulldog who I lost a couple of years ago. This was Spanky, and he was with me for nearly 14 years. So right now I'm the
It's
go-to
so
guy.
hard to lose your pet. I
It is.
know.
It
The
is.
saddest. So,
You're never ready
um,
for it. So I do a
well,
lot of, I'm doing dog sitting for friends, and not having a dog also has its benefits. Now I can be more free to travel. I love traveling, and I've been doing a lot of it during my retirement. I also bought a piano about the time I retired,
wow,
a baby
incredible.
grand, and I took a couple of piano classes, and I'm still struggling. I'll never be good at it, but I'm struggling to at
That's
least.
amazing though. That's incredible. I had a client like during a pandemic that took online piano lessons and was working it. So the
Yeah.
hats off to you, and to have a baby grand. I mean, you have no excuse. You got to be practicing.
Well, I
So,
really didn't know anything about pianos and little about playing a piano. And a friend of mine found somebody was giving away a baby grand piano on
wow.
the internet, and he went over there and got it and hired movers to move it, and then got it refinished. So my free piano ended up costing me thousands by the time I
Of course, of course. Well, that's
refinished
Murphy's
it and
Law of
moved
the
it
thing,
twice.
right? Oh
But
my God.
and it is so heavy. And then I found out by reading that any piano that's over 100 years old is basically worthless, because unless it's been in a well cared for in a concert
Wow.
situation, it's aged. It hasn't aged well. And my piano was built in 1918, so it's probably going to end up in the garbage dump eventually. But it serves my purposes, and it's a
For
beautiful.
now, it's serving your musical interests. So I
Yeah.
love it. I'm gonna have to hear a jam sometime. I love it.
And I just think it's like having a beautiful sculpture in your living room. It's such a beautiful
Oh,
piece of
I'm sure it's gorgeous. I know somebody would love that. So now tell me about your travels. You said you were enjoying traveling. What was your favorite trip that you've taken?
Well, I've always been sort of an independent traveler, like to keep moving and you know travel on the cheap, because I never had a lot of money for travel. But in my for my retirement and my 65th birthday, I planned this big trip to Scotland.
Ooh,
I rented you could call it a castle or a manor house in Scotland,
sounds
with
awesome.
7 bedrooms and 5 bathrooms. And I invited um, my family and friends. And this was 2022. We were just
2022.
coming out of the pandemic, and there was a lot of pent up desire to travel on the part of everyone. And Scotland was one of the main destinations people wanted to go to. So I had 26 people come in
Wow, that's a
various
big one. That's a good turnout.
not all at once, but it was wonderful. My nieces and their partners and my friends and my sister, all these people showed up in Scotland in this amazing uh, house on an estate in the country. And it sounds very extravagant, but it wasn't really. It was about the cost of a nice hotel room, but
Right.
you get 8 bedrooms and
And
five
how awesome is
bathrooms. And
that? Plus, you got the privilege of living in a castle for a couple of weeks
yeah,
there. So that sounds
there's no
pretty cool.
TV, no internet, no phone, but it was wonderful. We all had a great time. We were there for 10 days
Wow.
and cooking dinner each night and having cocktails. And it was kind of my fantasy. I guess I've read too many Jane Austen novels or watched too many
You
Downton
got to
Abbey.
insert yourself in one. I love it. So,
We had a
oh,
marvelous time, and I had such a good time. I did it again last year at
oh wow. With your
another castle in Scotland. So there's this nonprofit that runs these places. It's called landmarktrust.com. It's the UK version of it. They have like 200 different properties of various sizes that they turned into holiday rentals, and they're not really very expensive. And they take old buildings like an old lighthouse or a train station, and turn it into or a water tower and turn it into a holiday cottage with really nice modern kitchens and bathrooms.
Wow.
And
What was the name of that again? Landmark.com?
landmarktrust.com. And just look
Landmarktrust.com.
at
I'll have to check that
their
out.
website is just the pictures alone are just worthy of fantasizing about the
Yeah.
beautiful photography of these buildings that they manage.
So I'm sitting here thinking, William, you're a well-educated, well-rounded, interesting person, right? And you've
Mhm.
gotten the last few years, you've been, entrenched in Medicare stuff, right? Getting plans, finding doctors, doing things, and
Yeah.
obviously you have a pretty deep background connecting the dots on all of this kind of stuff. How difficult is the Medicare healthcare business for an
I would
individual?
I would say it was a lot more difficult than I thought it would be. I as a medical social worker working with seniors for all those years, I thought I understood Medicare, but I really didn't. When I was a social worker, I'd go into the homes of these older people, and they would invariably have a stack of medical bills on their dining room table, and they were completely bewildered. Even though it said in big letters, "This is not a bill." They would still get like completely freaked out about seeing like tens of thousands of dollars on their Medicare statement, and they didn't understand. And anyway, it is very confusing, and it has been for years. And then choosing a Medicare plan, thank God for you, Aaron, because I would have been lost if I didn't find you and talk with you, because
It is
it's
a bit, the complexity is a bit of job security for the Medicare agent. So I'll give it that, right? But so I'm so glad we were able to make the connection.
yeah.
What about the provider piece? Because I know like originally you kind of were in a Kaiser system and then you moved to more private doctors. How difficult or easy has it been to find quality providers under the Medicare program?
It started out rather difficult, but in the end, I felt like it all kind of came together well. I was at Kaiser, and I worked at Kaiser during the last years of my career, but my Kaiser physician left, and I just decided I wanted to go back to see this physician assistant who's working at a Sutter clinic that I saw years ago before I went to Kaiser, and I really liked him, and he was always seemed to be very attentive. I felt like I got good care for him. So you helped me find the one plan, the Medicare Advantage plan that covered his clinic. And is it okay to mention the particular plans
Of
here?
course. Yeah, I think
Okay.
it's fine. Yeah.
So it was an alignment plan, and it did allow me to see him. I went to see him, and it was great to, get the good care that I had always gotten from him, although I knew he was going to probably retire soon. And then,
And just to give a little backdrop for everybody, William. So basically, when Medicare beneficiaries have original Medicare A and B, one of the paths people can go down is to go onto a Medicare Advantage plan to cover the gaps in original Medicare. Those plans, what they have in common though, is they generally work with a specific network of doctors. And the plans that William is mentioning are Medicare Advantage, HMO style plan. So Kaiser has one of those where you go to just Kaiser, and then Sutter, specifically in San Francisco, but depending on the area, works with a certain number of plans. There really is that alignment choice in San Francisco that works with the Sutter plan. And then if you're willing to use another network of doctors like Brown and Toland or Hill Physicians or one of these others, there's a variety of other plans. And so basically, navigating this starts with who do I want to see, and then we take that information along with your prescriptions and try to match it up with a program that meets your needs. And that's how we found that Sutter alignment plan in the first place.
yeah, exactly.
So what happened from there, William? Because I know it didn't stop there. So what was next?
Well, after a couple of months on Medicare, it dawned on me that there was another plan that you told me about that offered a lot more benefits with it was an Aetna plan that had no premiums, no co-payments, had all sorts of extra benefits. And it dawned on me, I'm paying, a premium plus co-payments for this alignment plan, which cost me a couple $1,000s a year. And, what would it cost me if I went to see this physician assistant if I just paid out of pocket? And I called them and I said, well, it's $350. And I thought, well, I could see him a couple times a year and pay out of pocket. And then you get all the benefits of this other Aetna plan with no premiums and no co-payments. So I talked to you and you said, well, it's within the first, 90 days of Medicare, you could switch. I was kind of surprised. So you helped me switch to the Aetna plan, and I've been quite happy with that. It is a Brown and Tolan plan, and I did go online to do some research about Brown and Tolan did not have a great, Yelp reputation, but I searched around. I looked at Yelp reviews, and I read biographies of different physicians, and I found a doctor that I really like. And I actually never went back to see the PA because I like this new doctor. And I really feel like and the specialists he's referred me to have been great. I feel like I really got good providers, even though Brown and Tolan as an institution doesn't have a very good reputation, but the doctors I've seen have been great.
Right. Well, I think healthcare in general, when it comes to Medicare Advantage plans or the participating networks, they don't always score the highest on the Yelp ratings. But what happens is there's actually 5 different Medicare Advantage companies that work with Brown and Toland in San Francisco, and all of them actually get star ratings from Medicare on a scale of 1 to 5. So Medicare does independent ratings on the care and the benefits that people are receiving and how that access is being delivered through local networks. And authorizations and permission to do things and the experience can vary from person to person. But one of the things that I've noticed, William, and you can share with me, I think part of having a good care experience is finding that good primary care doctor that helps you navigate all of this. I mean, can you talk a little bit about that relationship with this doctor you found that you like and how that person has really helped you navigate this and connect you with the right specialist and really essentially ensure a good experience with the plan? Because that's really what it comes down to is your access to care.
Yeah. Well, I have to say that I feel like I've had to do a lot of that myself. I mean, a lot of the physicians have good reviews, but their office staff have very bad reviews. So
Right.
a lot of this is very much do it yourself. You have to connect the dots yourself. Following up with, and it's a Byzantine system. I sometimes don't know am I supposed to call Aetna or am I supposed to call Brown and Tolan or am I supposed to call the physician's office about?
You always have your broker if you need it.
Yes. And so there's a lot of different players in this. There's so many layers of bureaucracy and from Health and Human Services down to the Center for Medicare and Medicaid Services down to Aetna and Brown and Tolan, and it's a complicated system, and you have to advocate for yourself, and you have to ask questions. Now that I've been doing it for a few years, I feel like I understand the authorization system better. I know that a lot of it takes patience. You have to wait for the doctor's office to send in the authorization request. You have to wait for Brown and Tolan to authorize it. You have to wait for it to get to you in the mail or by email. So a lot of this stuff doesn't happen instantaneously, but I've learned that and have learned to be patient.
It takes a little time, but things can also be expedited if needed. So I definitely think that it's just good to be an advocate, like you're saying, William, but then always kind of tying into your support network, right? Your primary doctor would be
Yeah.
part of that network. I, as your agent, would be part of that network. And then your plan, the customer service department for your plan should be advocating for you. So tell me, just if you were advising someone to look at Medicare plans, Medicare Advantage plans, a lot of what we hear in the media is similar to the reviews you saw online. Medicare Advantage plans get a bad rap sometimes, right? People are like, whoa, avoid that. You've chosen it time and again and had a good experience. Can you talk about what your tips are for navigating the plans, and then why you think you've been so satisfied with an Advantage plan? What are the bonuses that have really made a difference for you?
Well, I think you have to advocate for yourself. You have to ask a lot of questions. And I think when you're choosing a plan, read those Yelp reviews, but take them with a grain of salt. Read the physician biographies, and you learn personal things about the doctors that are interesting. Um, a lot of it is luck, and if you find a provider you don't like, you can always change it. Nothing is forever. Use word of mouth. Ask your neighbors and friends who they see and whether they like their plan and their physician, and just ask questions. For example, I went in to get a cardiologist recommended a cardiac calcium score, and so I went into the lab and they said, "Oh, that'll be $99." And I said, "Well, why didn't anybody tell me I had to pay for this?" Like, I talked to 3 people on the phone about this, and nobody ever once mentioned that the insurance doesn't cover it. So I just walked out of there and I called Brown and Tolan, and anyway, eventually, after advocating for myself, they did cover it. But be prepared to ask questions and say no if you're not sure this is the right thing for you.
I love that feedback, because a lot of times, I mean, it can happen anywhere. It can happen at the lab, it can happen at the drugstore, it can happen at the doctor's office. And I feel like a lot of times we think whoever's talking to us must be an expert and must know exactly what they're talking about, right?
Yeah.
They must have it right. And 9 times out of 10, there could be some misinformation in there, right?
Yeah.
So maybe they didn't get the authorization place, maybe they didn't look at the formulary, maybe someone's meeting a deductible and they didn't realize it. So any number of things can occur, and it is important to advocate for yourself. And then, of course, when you're so good at it, but I do want to encourage people, you can tap into your agent or broker as well, which could be me or could be whoever you've chosen to work with, because that's what we're here to do. I mean, we get paid by the insurance companies to support you through the journey. So you can always tap into us as well, or call William. So now tell me
And
more, William. Oh, go
the
ahead.
other thing I would say that's important is when you're looking for a plan, one of the advantages of Kaiser is it was all under one roof. It's one system. And Sutter, has a big network, and a lot of times you can get all your care at Sutter under one roof, but other systems not so much. So, for example, under my Aetna plan, my primary physician was at Dignity Health, but Dignity Health, or at least his practice, was recently acquired by UCSF. So now suddenly I've gone from, and some of my other providers are at Sutter. So I have 3 different systems. And even though their medical records are supposed to be linked, a lot of times my primary physician can't see what happened at Sutter and vice versa. So again, you have to do a lot of connecting of the dots between the pharmacy, who's oftentimes a private external pharmacy, the lab that's a different company, the X-ray and imaging company is separate. There's a lot of times these systems don't talk to one another, and you're just bewildered about, where am I going to find these records? Are they in Sutter, or are they in Dignity, or are they in UCSF? Right. It can be very bewildering.
Right. Well, you've done it well. So talk to me for a little bit. I know one of the catalyst for Advantage plans, I read somewhere 51% of people nationwide that are on Medicare are on an Advantage plan. And something like 66% of those are on a plan with no premium at all. So you're in good company, William, with what you've chosen. And you do assign over some flexibility, right? You agree to use certain doctors, get the referrals, but in addition to a no premium plan and really reduced copays and share of costs for medical services, Medicare Advantage plans are known for what I like to call the bonus features: vision, dental, hearing, over-the-counter products. It's kind of a chicken soup of ingredients of different things that you can take advantage of. And I know your plan has many of those. Can you describe how you make the most of those benefits? Because I feel like a lot of people, I'm always saying, don't leave those benefits on the table. Like, don't forget to use your OTC or your vision or whatever. So how do you kind of manage that to get the most out of your benefits?
Yeah, I do. And it's one of the reasons I chose this plan. And I'm really thrilled with it, because I get so many of those extra benefits, and my out-of-pocket costs are just very minimal for everything I get through my Advantage plan. So, for example, but again, a lot of this is do it yourself. Like I go to the dentist, I have to pay the dentist, but then I submit my invoice and my dental care is covered up to, I don't know, $1,500 or $1,600 a year. So that's a huge benefit.
Right.
It's a huge savings. I get my eyeglass and vision care. One of the Aetna's preferred providers is Target, and I found a really wonderful optometrist at at Target, who gave me this really great exam, and she was very knowledgeable. I was very pleased with that, and they cover a big chunk of the eyeglasses that I got. I did go to the hearing. I got evaluated for hearing aids. I'm not quite ready to make the plunge on that yet, but at least
you didn't quite yet. You're good, but that's okay. Keep checking.
Yeah, and then the over-the-counter benefit is really a nice advantage. Although I also don't really believe philosophically that Medicare should be paying for my toothpaste and dental floss, but they do. I walk in to CVS with my little card, and it's like a debit card, and it covers healthcare items, including toothpaste and dental floss, which I think is a little ridiculous because I obviously can afford to pay for that myself, but I'm not going to leave that benefit on the table. And then the last thing I only recently discovered is that they cover my gym membership up to a certain amount every month. And it doesn't cover the whole thing, but it covers a big chunk of it. But again, I have to get an invoice from the fitness center I go to, submit it online, wait for reimbursement. But if you're willing to do all those things, they set up barriers to make it, challenging to get to get all these benefits. But if you're willing to do all those steps, there's a lot of advantages to it.
Well, it sounds like you're really jumping on them, and I love it. I wanted to comment. So it's interesting with Advantage plans. When you enroll in one, how they work is they get money every month for each person who enrolls, and that money is expected to take care of what Medicare covers and then any enhancements that they add to the program. And of course, the first focus is closing the gaps of medical care. But what happens is the plans then have, let's call it money left over in the bank, right, to spend on some additional benefits. And Medicare, I'm sure they would probably all love to keep it for the bottom line, but Medicare doesn't allow that. So they say, if you have left over, you can keep somewhat for covering your costs, but you need to invest into additional benefits for members. So that's where you see things like the vision, the dental, the over-the-counter. Over-the-counter is interesting. And I think one of the reasons that they cover some of the OTC things is, for example, like taking good care of your teeth, even the toothpaste and the floss or whatever. Good oral hygiene can lead to, or the lack of good oral hygiene can lead to more serious medical complications. So I think that's the idea behind it.
Yeah.
But I get what you're saying, but it's nice that those benefits are there, and you're right. You got to take advantage of every ounce of it and make the most of the benefits. So I'm so glad
those benefits are typically not provided by, insurance, commercial insurances that working people pay for.
No.
So I know that these insurance companies are trying to capture market share. So that's part of it too. They're competing by offering extra benefits, and it's to my advantage. So why should I complain? But I still do.
Right. Well, William, I love it. So you turned 65, you went to Scotland with a party of 26, you got a healthcare plan that had all these extra bonus perks. 65's been good on you. I love it.
It has been. And, I'm enjoying it. And I've got another trip planned to Italy this summer.
I got to get on your distribution list for all this. This sounds really good. So now, thinking back, William, think back to your 25-year-old self. It's a while ago, right? When you think back to him, what would you say to yourself? What advice would you give?
When you're young, you spend so much energy, chasing your career, chasing a relationship, and I suppose in terms of a career, I probably should have I bounced around from in a lot of jobs that weren't right for me. 2 years here, or 1 year here, until I found my niche, and I'm glad I did. But I was, well into my 30s when I finally found my calling in working in end of life care. But I guess I, probably should have gone to work for for Kaiser earlier, or a big company where I had better salary and better benefits and a pension, which I now I'm getting a little pension from Kaiser at least. But, I went to work for smaller nonprofit organizations that, grassroots that couldn't really afford to pay well. But I did fine for myself. I invested wisely, and I'm doing fine in my retirement. But I also think I wish I had taken more vacation, or found a job that offered more time off, because I should have. I love travel. I did a lot of traveling, and I went to some very exotic places. But I wish I had done more of it when I was younger,
Right.
before globalization, when you could really have some exotic experiences in out of the way places, and that's harder to do nowadays.
Yeah,
So I wish I
it
had
sure is.
done
So
more
great.
adventure traveling, because now I like the creature comforts, and I'm not willing to.
I know it becomes a lot more difficult to do it on the budget you talked about earlier as you get older, because we're more picky.
Yeah,
The floor is no longer an option.
yeah.
So William, you came to the show today to share your healthcare experience. If you were to leave us with a take-home message, what would it be?
Well, I think my message, and what I'm finding is important in retirement, is health becomes a bigger concern. Like every day, there's something new hurts. So I think preventative health care, getting exercise, walking at least 30 minutes a day, or doing something to keep your cardiac health, watching one's diet, and getting regular screenings. And I was diagnosed last year with prostate cancer, and I got radiation, and I'm hopefully cancer free now. But I caught it early, and that's so important to pay attention to those screenings. Um,
100%.
and setting goals in your retirement, keeping active and engaged with people. Um, um, yeah, and one of the rules that I have with my other friends who are retired or over 65 is, when we get together, we're only allowed to talk about our health problems for 5 minutes, then each, and then we have to move on and talk about something else. I don't,
Oh,
I
yeah.
don't
That
want
would
to be.
that would end 90% of my conversations, William.
Well, social conversations, that's,
I get it.
5 minutes is enough. Yeah, I don't want to do the organ recital, but I
Yeah.
find the impulses to talk about our latest, ache and pain
Absolutely.
and medical procedure. But really, there's so much more to life than that, and in retirement.
Absolutely. Absolutely. Well, you're certainly an inspiration, William. I'm so glad to get to know you a little bit better. Thanks so much for joining today, and come back anytime. Have fun in Scotland and
Thank
Italy
you,
and whatever's
Aaron. It was
next.
great.
Talk to you later. Bye.
Yes, for sure. Take care. Bye bye.